the dental assistant program here at NMC. And today you can see we are in our dental clinic, and I'm going to give you a little snippet or snapshot of some of the things that you would be doing if you were in the dental assisting program. Again, this is just a very small portion. We do cover a lot of information in our program. I hope you enjoy it. We are in the dental clinic this morning, and Dr. Stoy and one of our students, Rachel, are doing a composite restoration. And I just wanted to give you a snapshot of what actually happens in the dental assisting program. Dr. Stoy is fantastic with our students. He gives them kind critiques and shows them what it is really like to be in a dental office, and really helps prepare them for the real life situations. You can see they pass the instruments like you would in a dental practice. They know how to wear the proper PPE. You can see we have everything on the big screen camera, so that if other students need to watch, we have the availability for them to do that. And now they're going to place the white or the tooth color filling, which is called composite. And we have a full setup, as you can see, just in a regular dental office. We have all the drills, instruments. Students do not need to purchase any of the instruments. They are provided as part of the program. Our students are currently using an intraoral camera, learning how to maneuver it inside the mouth, and it helps when they are in a regular dental office, which helps the dentist identify what's going on up close. And it's a great tool for patient education. So when they're working in the mouth, they can pull it up on the screen like you see here and go over why the doctor recommends certain procedures. The dental assisting program takes 24 students, and we do have a certificate program as well as an associate degree. And if anybody was wondering, the current wage is $18 to $25 an hour to be a dental assistant. Going through our program allows the assistants to sit for the RDA exam or the national exam for a CDA, which is a certified dental assistant. And the RDA is a registered dental assistant. Because we are an accredited program, you can sit for those exams. And the CDA is a national certificate, which most 50 states recognize the CDA. RDA, a few states do, but Michigan, it's kind of the standard of which Michigan goes by. But you can see Katie, our student, has the intraoral camera, and Lena, our other student, is the patient in the chair.
So our students right now are doing what's called a rubber dam. It's an isolation technique that's part of the expanded duties that an RDA can do in the state of Michigan. And what we do is, because it's part of being able to qualify for your boards, is we start off in this chairside class with teaching how the student should be able to do it on our Dexter, our mannequin. And then from there, we start off with just a few teeth and keep working our way up to 7 to 10 teeth. And so next week they have an evaluation on Dexter. And so we are doing what's called a peer evaluation today, where Stacy's partner is watching her go through the steps and grading her and kind of getting her ready for her evaluation next week with me. In the summertime, students bring in a patient and they get tested out on a real patient doing this procedure. Practice before you're getting evaluation on.
This is Lena. She's one of our students in the dental assisting program. And we prepare you how to process instruments in chairside clinic, but also in the infection control class that you take in the fall. That's part of the academic portion of the dental assisting program. But she knows how to stamp and put the tabs inside of the packet so that it allows us to be able to tell that the instruments were properly processed and sterilized. And so she's just demonstrating some of the steps that we go through to make sure that the instruments are properly sterilized. So she's going to put the instruments into the autoclave, and we do check the autoclave weekly to make sure that our instruments are sterilized. And then she's going to show you how to run the Statum, and that is our quick turnaround sterilizer. So if you would need like hand pieces or any instruments pretty quickly, it's our rapid sterilizer. And same thing, she puts process indicators to make sure that our instruments were sterilized in the process. The dental assisting program is a year long. It starts in the fall and runs to August. But the summertime is pretty much you are in a dental office doing your extern hours. And if you are working in a dental office, which 90% of our students already have jobs in a dental office because they're in such high demand, that you will actually get paid to do your internship or externship hours. But that's a good problem to have, is by the time they graduate, our students are placed for employment. And this equipment is exactly what you would see in a dental office. So it really gives you great skills to take from the program into a dental office. You feel proficient, you don't feel lost when it comes to processing instruments, and you know how not to cross-contaminate between patient to patient. This is Bella. She is one of the dental assisting students, and she is practicing placing amalgam. Placing amalgam is one of those state board duties. She's going to mix some amalgam, so I'm going to wait for the noise to get done here. And placing amalgam is a requirement for their RDA exam, their state board exam. So they have to be proficient in placing an amalgam restoration. So it's part of our program to prepare them for that. They will also learn how to place the tooth-colored filling or a one-surface filling, which is part of an allowable duty for an RDA in the state of Michigan. And after they become proficient in placing silver fillings, then we teach them how to do the white filling or composite. During their clinical externships, they are working on patients, and they are actually placing fillings on patients as part of the program, hands-on in their externship. But we want to make sure that they pass their state board, so we definitely have them practice this. And also, part of their state board is they learn how to make a stainless steel crown, and we prepare them well on how to do that as well. But everything they learn, they take with them to the externships, and they actually practice everything hands-on in a dental office. All right, next we're going to talk a little bit about the academic portion of the program. We do a lot of hands-on in the program, but you see our skulls. Dental anatomy is part of the academic portion of the program. You learn not only individual teeth, but you learn the muscles and nerves of the face. And you can see some of the hands-on experience. You'll learn to see the eruption patterns of the teeth. And like I said, you will learn the muscles and the nerves of the teeth, skull. That way the dental assistant knows when the doctor is giving an injection, how the nerves are going to affect when he gives the injection and where those nerves are. It really does a nice job letting the students be able to know how many teeth and root structures are. If somebody's doing an extraction, they know, okay, the molars either have 2 or 3 roots when the doctor is doing that extraction. And part of dental anatomy is we do cover all the body systems because everything that happens within your mouth affects your entire body. So we not only learn about the dental anatomy, skull, but we do cover the body systems as well. Another portion of the academics in the NMC Dental Assisting Program is we do office management, and we prepare you how to be a front desk office manager. We prepare you how to use dental software. It's the whole package because our program has something for everyone.